In this video, we are going to be looking at the various structures and blood vessels associated with the heart. So here we're looking at the heart from the front, which is also called the anterior view. Please keep in mind when we look at it from the front, your right side is actually the left side of the heart, and your left side is actually the right side of the heart. So just be careful when you're labeling the diagrams on the test. Let's take a look at the blood vessels that we can see from the surface of the heart. Over here, you can see there is the superior vena cava, which collects blood from the upper portion of the body, and those would be oxygen-poor blood that will be returning to the right atrium. Similarly, at the bottom, which you can't really see at the front here in this model, but if we rotate at the back, you can see there is the inferior vena cava, and that would be collecting oxygen-poor blood from the lower portion of the body and returning it to the right atrium as well. Over here, we see another blood vessel, and that is the pulmonary artery. The function of the pulmonary artery is to send the blood to the lungs for reoxygenation. The pulmonary artery goes up, and it in this case is going to go to the left lung, and it goes behind these two things and comes out here going to the right lung. You can probably see a little bit better if we rotate the model and look at it from the back. You can see how the pulmonary artery comes up and then it split into the left and right portion. After going to the lungs, the reoxygenated blood is going to go back to the heart through these pulmonary veins, pulmonary veins on both sides, and that would feed into this structure right here. That is our left atrium. So going back to the front now, there is another blood vessel here. This is the biggest blood vessel in the body, which is the aorta. The aorta is gonna send oxygen-rich blood basically throughout the entire body. It's not clear on this model, but in your workbook, you can see the aorta actually will form an arch, and then it's going to continue to travel downwards at the back of the heart and going towards the abdomen, and it's going to become the abdominal aorta. It will also split into three smaller arteries that will supply blood to the head and to each side of the body. Now, even though the heart is going to be carrying blood inside its chambers, the blood is actually passing through at very high speed and high pressure, which makes it not ideal for extracting the oxygen from them. And so the heart relies on a network of these coronary arteries to obtain the oxygen for its muscle. If the coronary arteries are partially blocked, then the person might experience chest pain or angina when they physically exert themselves. Or if they become completely blocked, then it would lead to a heart attack, which is also known as a myocardial infarction. Let's open up the heart and take a look at the structures inside. You can see the four chambers of the heart, the right atrium over here, the right ventricle is right below it. On the other side, we have the left atrium and the left ventricle. Pay attention to the thickness of the wall of the left ventricle. It is the chambers with the thickest wall because it needs to generate enough force to send blood throughout the entire body. You don't need to have as thick of a wall on the right ventricle because the lungs are just nearby, so the force you need to send the blood to the lungs, it's not as great. So two atria on the top, the right atrium, the left atrium, and then below them you would have the left ventricle and the right ventricle and the left ventricle once again. Now the blood on the right side are going to be oxygen-poor blood, whereas on the left side here, it's going to be oxygen-rich blood, and we don't want to be mixing them. Otherwise, you're going to reduce the oxygen content of your blood, and that's why there is a muscular wall that separates the two halves of the heart, and that is called the septum. You can also see there is it's kind of falling apart here, but let me just try to fix that right there. there is going to be a valve over here, letter M, and then over here, letter N, there is another valve. These two valves collectively are known as the AV valves, and they separate the atria from the ventricle. The one on the right side is called the tricuspid valve because it has 3 flaps, and on the other side, we have the bicuspid valve. Some of the older textbooks, they also call it the mitral valve. But they are collectively known as the AV valve. They will either open together or close together. Over here at the entrance to the pulmonary artery, you see that there is the pulmonary valve, and that prevents blood from going back into the right ventricle. And on the other side over here at the entrance to the aorta, there is the aortic valve, which would prevent blood from flowing back into the left ventricle. Okay, so I forget to mention the pulmonary valve and the aortic valve together. They are collectively known as the semilunar valves, and they would be opening and closing in sync with each other. Okay, so whenever the semilunars are closed, then the AV valves will be open, and whenever the AV valves are closed, then the semilunar valves will be open. In another video, when we talk about the circulation, we'll give you more information about the function of these valves. And that's it for the anatomy of the heart.